Hello, everyone. My name is Stephanie Boynton, and I'm a registered nurse in the emergency department at River Hospital in Alexandria Bay, New York, a critical access hospital. I graduated from the Florida State College of Jacksonville with my associates in nursing in 2021 and from the American Military University with a bachelor's in nursing in 2024. Following graduation from Florida State College of Jacksonville, I worked in the operating room setting at Southeast Georgia Health System in Brunswick, Georgia, as a staff nurse. In 2023, I began traveling as an OR nurse to several locations, including a level 1 trauma facility in Columbia, South Carolina, as a member of the neurotrauma team, a community hospital in Oswego, New York, and a provisional level 2 trauma center in Watertown, New York, where I concluded my time as a travel nurse in 2025 and began my time in the emergency department. Throughout my time as a nurse, I have worked near military bases and spent a significant amount of time caring for service members and veterans in these areas. Service members who have completed their term of service often suffer from PTSD, substance abuse, and suicidal ideations during the transition to civilian life. Veterans who experience these challenges often find difficulty in securing reliable employment and/or initiating or maintaining enrollment in secondary education. This leads to exacerbation of PTSD, substance abuse, or suicidal ideations, and worsening of the veteran's mental health status and subsequently overall health. This gap in support for the transitioning veteran is the focus of my project. My project aims to implement early screening of transitioning service members for risks such as PTSD, substance abuse, suicidal ideations, lack of social support, and employment planning, using an evidence-based screening tool called the Veteran Transition Tool to identify these individuals before they enter crisis. This ties into the AACN domains of person-centered care, population health, knowledge for nursing practice, systems-based practice, informatics and healthcare technologies, and scholarship for the nursing discipline. Implementing an evidence-based screening tool early in the service member transition to civilian life process will hopefully provide awareness and resources to support the veteran after military life. This project will foster more culturally sensitive care for this population and require multiple systems to collaborate to coordinate appropriate resources and care. The combined social and clinical nature of this project will deepen knowledge for nursing practice. Implementing the VTS screening tool into clinical flow will require support and spur innovation through informatics and associated healthcare technologies. In reference to career goals, I plan to gain experience as a nurse practitioner working in a neurosurgical ICU, leading to a position on a neurosurgical team. With this experience, I plan to care for veterans in a team setting in the Gettysburg, Pennsylvania area who may benefit from neurosurgical intervention to improve PTSD or TBI symptoms. Another personal goal of mine is to start a 501c3 program for an equine retreat, centering around holistic and person-centered care for those veterans suffering with TBI or PTSD symptoms. This draws on the AAC domains of the population health and leans heavily on the development of interprofessional relationships, professionalism, and leadership development. Earning a DNP degree will enable me to become an independent and holistic practitioner by developing the professional and clinical skill necessary to achieve this goal. In this first year of the DNP program, I have developed professionalism and leadership skills as I have transitioned from the operating room to the emergency department as a charge nurse with few resources and minimal staffing. I have developed a keen sense of person-centered care, population health, and quality and safety as I assess and triage resources based on patient needs in a rural and unforgiving climate in upstate New York. My educational goals include passing the qualifying exam this spring, sitting for the comprehensive exam as soon as possible after maternity leave in 2026, completing my didactic year in summer 2026, and beginning clinical rotations on time in spring 2027 after maternity leave, with graduation from Penn State with a DNP degree in spring 2028, all while continuing to work as a registered nurse in the acute care setting. Thank you for your time and consideration.